Dr. Ntombi Mhlongo-Sigwebela. I'm a Deputy Chief of Party within the TB Program. I work under Right to Care. The TB Program itself is funded through USAID to provide technical assistance to PEPFAR-supported countries as they scale up on HIV test and start. I am responsible for oversight of the technical activities in terms of delivering on the mandate or the objectives of the program. And one of the key areas that I focus on is ensuring that countries that we support are ready and have the capacity to implement test and start, meaning that they have the ability to find more people who are HIV infected, put them on treatment, and ensure that those who are on treatment remain on treatment. This is basically the targets that have been set according to UNAIDS 1990 strategy. What we do in terms of working with the different countries, after the initial visits and the agreement on which areas TB is going to support on, which are based on the identified gaps in the country by the USAID missions, the ministries of health, and the partners that work within that country. We have developed a tool, which is a tool that assesses very rapidly the readiness in terms of available policies, staffing levels, the burden of disease, and the flow of patients within facilities, and the availability of drugs, the management of drug and laboratory supplies, the availability of laboratories for viral load testing, and the supply chain for delivery of commodities within facilities and outside of facilities. This tool we have used in a number of countries to identify where the bottlenecks are in terms of scaling up implementation, and it has proven to be very useful in that it assists countries to rapidly identify these bottlenecks, put interventions in place, and then be ready for the rollout. Test and start, or test all and treat all, as it is known in some countries, is important in terms of reducing new infections, as well as reducing mortality and morbidity from HIV infection. If we are to reach the UNAIDS 1990 goals, then it is important to focus on making sure that everyone who is diagnosed with HIV is put on treatment. The implementation capacity assessment tool that TB has developed is very unique in that it is able to rapidly assess all the key areas that are important in the scale-up of test and start in order to reach the 1990 goals. Unlike other tools which might require a week to complete all the relevant sections, or to evaluate the different program areas for HIV implementation. This tool can be used in a facility, and information can be collected within 2 to 3 hours, and it gives you a snapshot of where things are and what it is that is causing challenges or might be a challenge going forward. The tool has been successfully used in a number of countries, which include Lesotho, Zambia, DRC, Malawi, and Burundi. What is unique again about the tool is that you can adapt it to the situation. The format that was used in Lesotho is not exactly the same as what was used in Zambia, because the health systems, the structure of the health systems is different in the different countries, but it's almost accurately assesses the needs, the gaps, the human resources, the infrastructure, and everything that forms part of an HIV program. In Zambia, for example, the use of the tool was very important in helping the country to determine how they move treatment closer to the communities by decentralizing the distribution of drugs, and also creating pickup points that will be closer to the community, and also working with multiple stakeholders to ensure that those who need to access treatment do so in an efficient manner. And it's also been used in Lesotho to identify key populations that were previously neglected, which were now readily identified, and there's going to be specific interventions that target them.